Hi, today we are going to know about the Holter monitor. It's an important biomedical instrument used for continuous monitoring of the heart's electrical activity. Okay, a normal ECG records the heart's activity for only 10 to 15 seconds. Okay, many heart rhythm abnormal, that is many heart abnormalities. The term itself known as arrhythmiasis occurs only occasionally and may not appear during the short recording. Okay, to overcome that limitation, Dr. Norman J. Holter developed the Holter monitor in 1949. Okay, a Holter monitor records the ECG continuously for 24 to 48 hours, and in some cases, up to 7 to 14 days, while the patient performs normal daily activities. Okay. So, a Holter monitor is a portable battery operated ECG recording device that continuously records the heart's electrical activity for an extended period to detect the intermittent cardiac abnormalities. So, what is the principle based on Holter monitor? It works on the principle of continuous electrocardiographic recording. Okay, electrodes attached to the chest. It detects the heart's electrical signal. These signals are amplified and filtered. The processed ECG is converted into digital form. The data are stored in internal memory. After monitoring, the recordings are transferred to a computer for analysis. Okay. So, what are the components in Holter monitor? So, first one, the electrodes. So, what are the components in Holter monitor? So, the first one is electrodes. Electrodes is a disposable adhesive electrodes attached to the chest to detect the electrical activity. So, next one, the lead wires connect the electrodes to the recorder. The third one is ECG amplifier. It amplifies the ECG signals. Okay. The next one is the filters. It removes the electrical noise and muscle interference. So the next one is ADC, that is analog to digital converter. It converts the analog ECG signals into digital data. Then the microprocessor, it controls signal processing, timing and data storage. The next one is memory. It stores the continuous ECG recording. The next one is battery. It provides power throughout the monitoring period. Finally, the software analyze the heart rhythm, heart rate, and process and arrhythmiasis. Okay, one. The Holter monitor works by continuously recording the electrical activity of the heart. While the patient performs normal daily activities, unlike a standard ECG which records only few seconds. Okay, the Holter monitor records continuously for 24 to 48 hours or longer, helping detect intermittent heart rhythms and abnormalities. The first one is step 1, electrode placement. Small disposable adhesive electrodes, usually 3, 5 or 7 electrodes, are attached to specific positions on the patient's chest. The skin is cleaned and if necessary, hair is removed to ensure good electrode contact. These electrodes detect heart's electrical signal. Step 2 is signal collection. Each heartbeat generates a small electrical impulse. The electrodes pick up these weak electrical signals and send them through lead wires to the Holter monitor. Then the step 3 is signal amplification. The ECG signals are very small, about 0.5 to 5 megavolt. Inside the Holter monitor, an ECG amplifier increases the signal strength without changing its waveform. This makes the signal suitable for further processing. Step 4, signal filtering. The amplified ECG signal may contain unwanted noise caused by body movement, muscle activity, that is then the power line interference. Power line interference means 50 bar 60 Hz, etc. Electronic filters removes these unwanted signals while preserving the actual ECG waveform. To step 5, analog to digital conversion, that is ADC. The filtered ECG is still an analog signal. The analog to digital converter converts it to digital data. Digital signals are easier to store and analyze. Okay. Then step 6, data processing. A microprocessor receives the digital ECG data. It records heart rate, heart rhythm, time of each heartbeat, any abnormal rhythms. The monitor stores the information continuously. Step 7, data storage. The ECG data are stored in a monitor's internal memory throughout the recording period. Modern Holter monitors can store several days of ECG recordings. Okay. Then step 9, patient activity diary. During monitoring, the patient performs normal daily activities. The patient records the time and symptoms such as chest pain, dizziness, palpitation are finding in a diary or by pressing an even button on the monitor. This helps the doctor to correlate the symptoms with the ECG changes. So the step 9, data transfer. After the monitoring period is completed, the patient returns the Holter monitor to the hospital. The stored ECG data are transferred to the computer using a USB cable. Okay. Docking station or wireless connection. Step 10, computer analysis and diagnosis. Specialized software analyzes the ECG recording. It identifies average, minimum and maximum heart rate, and then the bradycardia and tachycardia, arrhythmias, pauses in heart rhythm, ST segment changes, that is ischemia, pacemaker function if present. Okay. ST segment changes, that is ischemia, pacemaker function if present. A cardiologist reviews the report and makes the final decision. Okay. So then the types of the Holter monitor. There are 4 types of Holter monitor. First one is standard Holter monitor, the most commonly used today. Records the ECG continuously for 24 to 48 hours. It's suitable for the patient who experience frequent symptoms such as palpitation or dizziness. The patient wears the record on a belt or shoulder strap while carrying out normal daily activities. So second one, extended Holter monitor, records continuously for 13 to 14 days depending on the device. Used when symptom occurs less frequently and may not be detected within 24 to 48 hours. Okay, provided a long monitoring period, increasing the change of detecting intermittent arrhythmias. Wireless Holter monitor records ECG and transmit data wirelessly to a monitoring system or a hospital. Allows remote monitoring by healthcare professionals. Useful for home-based cardiac monitoring and telemedicine. The fourth one is patch Holter monitor, a small, lightweight, adhesive patch placed directly on the chest, does not require external lead wire, more comfortable for the patient and allows greater freedom for movement. It can record ECG continuously for several days. So standard Holter monitor, it is commonly used 24 to 48 hours. External Holter monitor, long term recording period. Wireless So what are the clinical application of Holter monitor? A Holter monitor is mainly used to diagnose heart rhythm disorders that may not appear during routine ECG. Since it records continuously during normal daily activity, it provides valuable information about the patient's heart function. First one, detection of arrhythmias. The primary use of Holter monitor is to detect arrhythmias, abnormal heart rhythms. It identifies bradycardia, tachycardia, premature beats, atrial fibrillation, heart blockage, etc. Evaluation of palpitation. Patients may complain of racing, pounding, or skipped heartbeat. If these symptoms do not occur during a routine ECG, the Holter monitor helps to identify whether they are caused by abnormal heart rhythm. Investigation of syncope. There is fainting. Some patients experience unexplained fainting or dizziness. Detection of silent myocardial ischemia. Some patients have reduced blood flow to the heart without chest pain. The Holter monitor can detect ECG changes such as hysterectomy, segment depressions that may indicate silent ischemia. Monitoring next one, monitoring pacemaker function. In patients with implanted pacemaker, the Holter monitor checks whether the device is functioning correctly. It confirms that the pacemaker senses the stimulus for approximately. Sixth one, assessment of the treatment. There is effectiveness used to evaluate whether medications prescribed for arrhythmias are controlling the heart rhythm effectively. It also helps doctors decide if treatment needs adjustment. Seventh one, post-heart attack monitor. After myocardial infarction, patients are at risk of developing dangerous arrhythmias. Holter monitor helps detect these rhythm disturbances easily. Monitoring after cardiac surgery. Patients who have undergone procedures such as coronary artery bypass grafting or heart valve Holter monitor helps assess recovery and detect post-operative arrhythmias. So the summaries of clinical application: detect arrhythmias, evaluates palpitation, investigates syncope, detects silent myocardial ischemia, monitor pacemaker's function, assess effectiveness of treatment, monitors patients after heart attack, monitors patient after cardiac surgery. So in conclusion, the Holter monitor is a portable, non-invasive diagnostic device used for continuous ECG monitoring over an extended period. Usually, it records the heart's electrical activity during the patient is normally daily routine, making it highly effective in detecting intermittent cardiac abnormalities that may not appear on a standard ECG. Holter monitoring plays a vital role in diagnosing arrhythmias, evaluating symptoms such as palpitation and fainting, assessing pacemaker function, and monitoring the effectiveness of the treatment. Due to this accuracy, portability, and ease of use, Holter monitor has been an essential foot in modern cardiology for early diagnosis and management of heart disease. Thank you.